Thank you very much. I'm actually going to share some slides here. Uh, Based on the comment to Dr. Johnson, thanking him for not using slides. Now, I feel terrible, but at the same time, knowing myself, I won't remember everything. So the slides are hopefully just an opportunity to keep me on task. Sorry, just aligning myself, but fantastic presentation, Dr. Johnson. And my assumption or expectation here is that a lot of what we present would actually leverage, basically on each other. My experiences are a bit different from yours, and it's funny when you said you've been in practice for 40 years. I'm doing my math and I'm coming up on 20 years, and it's scary, because I feel like I've been practicing for quite a while, but also I've made the shift, and I kept smiling when you talked about the benefit of leadership, healthcare leadership and management, and also fiscal management and healthcare economics, and how that partners with, healthcare practices. So that's primarily actually what I teach at University of Maryland. I teach healthcare finance, which is interesting. When I'm not in the academic institution, I manage patients in a cardiac surgery ICU. So we're kind of kindred spirits. I don't operate on cardiac patients. I take care of the disasters you and your colleagues send to my unit. We manage open heart surgical patients, ventricle assist devices, and stuff like that. So it's kind of interesting to see things from that perspective. I have several different vantage points that I'll be speaking from today. I've also been in the United States for about 25 years now. And for those who think I'm some lost soul, I lived in Nigeria from 2016 to 2018. And I didn't live in Lagos or Abuja. I lived in Ondo with my dad, so I've had some recent experiences. I was one of the pioneer leadership of the University of Medical Sciences in Ondo, helped as a pioneer founder for that university. And when I came back to the US, back at University of Maryland, I kept looking for ways to give back, just like you. I don't feel bad for making a lot of money because I don't make a cardiac surgeon's money. But at the same time, I was appointed commissioner for health just last year, and with as much impact as I can make here, I'm very aware of the healthcare gaps we have in Nigeria. So I've always wondered, about how I could make, an impact. So I started Health for Nigeria, and the goal for Health for Nigeria is to increase healthcare access for all Nigerians. And one of the ways that I envisioned being able to do that is to increase the capacity for healthcare leadership and management for healthcare professionals in Nigeria. So a lot of things you said, resonates with me. And I quickly found out that our healthcare leaders in Nigeria are not interested in additional knowledge in terms of healthcare leadership and management. So we need to put you in front of more people so you can share your story and just, have people listen to the impact that healthcare leadership and management actually makes on a healthcare practice. And I know here we're focusing on the private sector. The scarier part is individuals in the public sector in leadership are making the healthcare based decisions that impact the 200 million people in Nigeria. So with that, I'll start my presentation. So, uh, just like many of us, I have two vantage points. My MBA focuses on health, on international healthcare business. So whenever I think of healthcare, I look at Nigeria naturally because that's home, but I don't limit myself to either the US or to Nigeria. I kind of broaden my horizon just to kind of see how other continents are dealing with, healthcare finances and GDP and stuff like that. And so specifically for this presentation, I did some research, on how COVID-19 is impacting, the world, and the data is vast. So I just, took a small snapshot here just to help us sort of understand the magnitude. A lot of this data is primarily from American institutions and, well-known ones. So, for example, the Yale New Haven Health in Connecticut posted a $208 million loss in the first half of its fiscal year. Not the entire fiscal year, like the first half. From March to May, Queens Health Systems in Hawaii lost about $127 million. And just to put this in perspective, these are not institutions that lose money, period. As Dr. Johnson presented earlier, there's healthcare delivery, but there's also healthcare management. Healthcare is a business. I wouldn't say, forget the, Hippocratic oath, or, yeah, I mean, we want to be benevolent. We want to extend ourselves to patients, but at the same time, most importantly, healthcare is a business, and if it doesn't turn a profit, it will suffer. It will shut down. Adventist Health, which is huge in Florida, lost 263 million, and the list goes on and on and on. I did a lot of research, looking into Nigerian institutions, and unfortunately, we're not as transparent from an economical perspective. So I couldn't really get some concrete data from private or even public institutions in Nigeria. So just additional sort of research from preparation for this presentation, but also some of my experiences highlight not only the pre-existing challenges we had, but now, there's a proliferation with COVID-19 superimposed. So first, there's an inconsistent belief that the pandemic even exists. And regardless of what people say, I mean, actions speak louder than words. I'm sure many of us are on social media and we see the viral nature of gatherings in Nigeria, even recently, with no mask, no PPE, no social distancing, so in my opinion, that's still a challenge in terms of, the understanding of the pandemic and, the detrimental effects that follow. So some of our existing challenges, even prior to the pandemic, are now proliferated, the shortage of physicians. I did a lot of data and research for University of Medical Sciences while I was there. And even though this data is from 2018, but I think at the time, for our population of 200 million people, we only had 35,000 registered physicians in Nigeria. I don't think that data has improved since, which is interesting. We violated the 1:5 ratio for the World Health Organization by a mile. Also our GDP in terms of healthcare expenditures is probably one of the lowest in terms of comparison to the population for any country in existence. So our poor basic amenities, once again, if we're thinking to slow down the spread of COVID-19, includes hand washing and sanitary practices, that's a fail for us just based on our system. And then, Dr. Johnson also then mentioned healthcare tourism, and that's a very big one. So now in the face of COVID-19, that's also proliferated. So our testing practices, obviously for COVID-19, is a bit of a challenge for several different reasons. One, availability of the test. Two, standardized mechanisms to ensure that, we have correct outcomes for the tests. and even what to do with positive tests. Advanced systems with a positive test has a next step. For us, if you go out to get a COVID-19 test, you're handed your result, and that's the end of that encounter. So slow governmental responses. Many countries around the nation now are in several different phases of vaccination. And, we're still waiting to hear what our plans are in terms of even testing, talk less of vaccination. I think the last I heard, according to the Minister for Health, was that we're trying to secure 100,000 vaccines, which is challenging to hear, so once again, significant financial burden, which is really difficult to measure, which is what I was hoping to be able to find to present here. Whenever I talk about Nigeria, there are some aspects of our country, our leadership, our healthcare system that's grim. But what I also understand is that in the middle of, these challenging times, there are several opportunities that, we might be able to take advantage of. So what are some opportunities for the private sector, which is, what I was asked to talk about here. Obviously, I don't own a healthcare institution like some of you guys. I am truly envious, but I'm from that management side. A lot of what Dr. Johnson was talking about is sort of where my expertise lies, with the ability to look at systems and identify efficient ways to make them run. So several different documented benefits in terms of the private health sector comes now as opportunities. So one, I just talked about the potential for efficiency, and also within a short period of time, ability to provide opportunities for those who can afford healthcare. The rising demands, I know Dr. Johnson talked about this in terms of demands based on our population. Yes, we have a population of 200 million people, and if you're thinking of scalability and population health, we should be further ahead in terms of resources, finances, but that's a multifactorial issue. And I think leadership is on top of that, or at the top, of the issues. But we have rising demands. We have more flexible budgets compared to the public sector, which is riddled with bureaucratic tape. So some specific opportunities that I'll basically talk about now in terms of COVID-19 and just looking into the future include taking the lead, in eradicating COVID-19. The public sector is not really doing much about this, so I believe there is an opportunity for the private sector to see how this might be an opportunity. The use of new delivery models to improve access to healthcare. This was a pre-existing issue, and I think it's only going to continue to be an issue. Investing in digital innovation and transformation. Nigeria has a potential to be a hub for innovation for not just Africa, but for the world. I mean, I keep seeing these graphics of, the top 5, top 10 countries, to explode in terms of innovation over the next 10 years. And Nigeria seems to be part of that. I know Africa as a whole, but Nigeria seems to be part of that conversation. And I think, part of it is because of our population. So there has to be a way to harness this. I think the private sector has an opportunity there. Building up its relationship with the community in terms of stakeholder engagement. And I'll just talk a little bit about health promotion and disease prevention, sensitization. Currently, I'm a part of a steering committee for the strategic plan for University of Maryland, which is an 8-campus, very large public institution. And one of the first things we're actually looking at is re-envisioning exactly how that institution could be an anchor institution for the state. I think, thinking about the private sector in Nigeria, I think that's sort of the vision, in terms of what the strategic role of the private sector is. How can the private sector stand tall right now in the midst of COVID and sort of looking forward? Sensitization, just regarding safe healthcare practices during the pandemic. I think that's an opportunity. I've recently been in the middle of several campaigns, not just for COVID-19, but also for the vaccine, education, testing, and also not just education about healthcare promotion and disease prevention, but addressing vaccine hesitancy. Um, and this is not just a Nigerian issue. I think it's a minority issue across the world. Anyone who has done any work with IRBs would know some of the challenges we faced in the past with testing on minorities, unfortunately. So there's a bit of a challenge there. We need to flatten the curve to eradicate this. Then we all need to get vaccinated, and there's still a bit of a gap there. And then just planning for the future of Nigeria. I talked a little bit earlier about the population, but if you're thinking about how large the population is becoming, we should also then think about comorbidities in terms of healthcare challenges for our population. And as we know, as people age with multiple comorbidities, that's where the issues arise. Um, Dr. Johnson talked about health insurance agencies, and I promise you, I think that that's part of is a significant solution to the healthcare problems in Nigeria. I think first we have to have a digital system that can track people, that can and not track in terms of invasion of privacy, but a digital system, that gives us the opportunity to have connections digitally for our names. Are in the US, it's social security numbers. I know in Nigeria now there's the NIN that's coming out, but there has to be something that data codes us as individuals, that gives us the opportunity to take advantage of some of the population health strategies, that might start to address some of our healthcare issues. Understanding more about our social determinants of health. That's where a lot of finances are actually going now in developed countries. We need to be able to predict, I see us as a very reactive people, but I think we're at the point now where we can anticipate certain healthcare challenges before they occur and address them downstream. The biggest one, investing in healthcare leadership and management strategies, and I mean this out of all humility. Being a medical doctor does not make you a leader. I'm sorry, it just doesn't. I appreciate Dr. Johnson going first and talking about his experiences as a cardiac surgeon. Healthcare management leadership is completely different from healthcare delivery to patients. And I think, the moment we understand and embrace that, we can genuinely start making decisions, positive decisions that impact, our population better. We need to partner with the community and our emergency response. So I mentioned earlier that I lived in Ondo and I lived there for 2 years. And naturally, I mean, as a relatively young guy, there isn't a lot to do socially in Ondo. So I would go to Lagos quite frequently. And one of my biggest concerns for the entire 2 years I lived in Nigeria, yes, security was a concern, just applying the Ondo or road. But I always wondered if unfortunately, if I got into an accident, what would happen in terms of emergency response. So by training, my specialty is trauma and critical care, so I see those patients. I mean, I know how critical, early intervention is. And, that just kept playing in my mind. That's actually, just one of my biggest concerns with traveling in Nigeria. God forbid, accidents happen every day. But if they occur, like how do we manage our emergency response systems? Do we even have, a functional emergency response system? So leveraging on healthcare technology to shorten the healthcare gap. In my role as a commissioner for health for the state of Maryland, we have several different discussions about how to improve access to residents in the state of Maryland. And two of the big things we've talked about over the last year include naturally COVID-19, vaccination, education. But the biggest thing is telehealth. I will admit here openly that I was one of the people that thought Uber would never work in Nigeria. I was one of the people that thought healthcare technology would never work in Nigeria. But it's funny how we pick and choose the technology that favors us, and then we sort of don't necessarily invest in the ones that we actually need. I think Nigeria is a fantastic test bed for telehealth and telemedicine. Everyone has more than one cell phone. Like it's mind blowing, in Nigeria because we need one for what are the different carriers in Nigeria now. Even while I was there, I had two phones, because if one network, wouldn't work, I have to use a second network. But one of the ways where we can actually deliver care without worrying about transit time, without worrying about overheads. Yes, I mean, some of those things would still apply, but to a lesser degree would be the use of telehealth. And here we're actually expanding just through COVID-19 for the state of Maryland. We have a bill that we're trying to pass right now to where synchronous, asynchronous, and audio only interactions would count, and would be billable as telehealth and telemedicine encounters. You know, these are no longer novel because everyone and their sisters, their brothers, their mother, everyone has some form of technology. Electronic health records, I put this up there with health insurance in terms of solutions, looking now and looking into the future. If you were to present to a physician in Lagos today with a health related challenge and you get worked up, and tomorrow you go to another institution or another physician, they're going to repeat the process. I think just the too many chefs, will destroy the cooking. Like in this case, is detrimental to the health of Nigerians in the sense that depending on the training, depending on the efficiency and astute nature of our healthcare clinicians, there has to be continuity of care somehow. I think electronic health records would work in that sense. Health-based apps. I wear a Fitbit. I'm sure some of us, are now starting to invest in these. These are things that we're starting to give away here. On-demand healthcare, health data collection. That's another big area that I believe we need in Nigeria. We need data. We need data to be able to work within the confines of population health. Unfortunately, these are just significant areas of lack, and not just data collection, which takes time and costs money, but also now we need data storage ability, and thinking about that, security issues, power issues. So our issues are multifactorial. I spoke earlier about the care of the community and also seeing the community as stakeholders rather than sort of a capitalist environment, which unfortunately I feel we've become. Not necessarily because that's what we want to do, but that's what we've become. Rather than growing the population in Nigeria, unfortunately, a lot of the dynamics just seem to not favor the people. Quality of healthcare, just patient interaction, patient satisfaction, all those quality metrics are very low. Yet those are the people we serve, and those are the people who pay, just to ensure that we remain gainfully employed. I think strengthening that relationship will improve our opportunity to collect data and also just to deliver better care. The more data we have, the better the relationship, or the better the relationship with the community, the more data we have, and the better we can plan for some of those things as, responding to emergencies. And now this is probably just more rudimentary, but one of the reasons why we're doing this in the first place, how how can we see ourselves as ambassadors, for health promotion and disease prevention rather than just this sort of patient-centered focus? I think sometimes we forget that our patients are, on the same continuum as the society as a whole. If we don't take care of the society, then we're in a vicious cycle. We have to sort of stop and think in, rather than just the secondary treatment of diseases. How do we start to sort of work our way back, to like health promotion practices, disease preventions, like, vaccinations, nutrition, sexual health and education, healthcare policy. I teach in elementary schools. I mean, I actually go into elementary schools probably once every 6 months just to talk about healthcare. These are things that I get paid to do, but I mean, in my opinion, I think that level of sensitization for children is important, because that's sort of what gets them on this journey moving forward. How are we impacting society, as a private sector? Once again, though, I know the horizon is grim, but just like everything else, the Spanish flu, Ebola, we got through those things, but I think progressive communities don't get to the other side of a pandemic like this and remain the same. Something needs to give. I love philosophers, and Albert Einstein is one of my favorite. And there's that quote that doing the same thing over and over again and expecting a different outcome is the definition of insanity. I think we are insane people as Nigerians sometimes, because we seem to fall into the same pitfalls over and over again. So hopefully, this is an opportunity for us to reset, during or after this pandemic. And once again, I think it starts with leadership and it works its way down. This is one of the campaigns I'm a part of, along with Reliance, working on COVID-19 sensitization and trying to address some of the vaccine hesitancy issues. And we posted this campaign on LinkedIn, and within 24 hours, we've received calls from the World Health Organization, the CDC, and UNICEF looking to partner to work with Africa, in terms of some of these initiatives. Whenever these things happen, though it's exciting, but I feel terrible because I keep thinking of, how we Nigerians who leave the country and do all these fantastic things can't seem to get our own country right. So once again, thank you very much for the opportunity to present here today. Hopefully, I mean, I've given us some things to think about. Hopefully, I've given us an opportunity to spark, some meaningful dialogue, just introspecting and thinking about how, in addition to our practices in the private sector, we can start to extend also to the community. So.